Welcome to Instant Truth Trivia, where learning could save a life. How ready are you to respond in an emergency? Let's find out. What is the DRS ABCD sequence used for? Assessing and managing a casualty in emergency response. What does the P stand for in the sample acronym used when taking a medical history? Past medical history. In case of chemical burns to the skin, how do you treat it first? Rinse with large amounts of clean water. When you suspect a person has severe dehydration, which of these is a common sign? Sunken eyes and dry mouth. What is the correct action if someone is having a seizure while in the water? Support them above water, call for help, move away from water after seizure ends. Which of the following is part of the chain of survival for a cardiac arrest? Both A and B. What is one of the first things to check for when approaching someone injured at a scene? Scene safety. Are there hazards? How should you treat a cold burn, frostbite, initially? Warm gently with skin-to-skin contact or warm, not hot, water. What is the FAST test used for? Recognizing stroke signs. For an adult choking, unable to speak, breathe, or cough, which is the correct immediate step? Perform abdominal thrusts, Heimlich maneuver. What is a key first aid step for someone who swallowed a corrosive chemical? Give milk or water if advised by poison control. Which of the following is a danger if you move a person with suspected spinal injury incorrectly? Risk of permanent paralysis. What's the recommended compression depth in adult CPR? About 2 inches. How do you treat minor burns, first degree? Cool under running water, cover with a loose, sterile dressing. What should you do if someone is bleeding heavily and you see bone or tissue in the wound? Apply direct pressure and call for emergency help. What is hands-only CPR? Using only chest compressions, no rescue breaths. How soon should you replace CPR certification or refresh training? Every 1-2 years. If someone shows signs of shock, pale, cold, sweaty, what position helps them most? Lay flat and elevate legs if no injury to head/spine. Which item is not appropriate for a first aid kit? Open package of gauze that's lost sterility. What is anaphylaxis? Severe, life-threatening allergic reaction. If someone is choking in infants under 1 year, what's the correct first aid method? Five back blows, then 5 chest thrusts. What's the purpose of tilting the head back and lifting the chin in an unconscious person? To open the airway. How long should you wait/check for normal breathing in an unconscious person before starting CPR? About 10 seconds. What of these is correct for treating a sprained ankle immediately? Rest, ice, compress, elevate, rice. If someone's clothes are on fire, what's the correct action? Stop, drop, roll. What should you do if someone swallowed a sharp object accidentally? Seek medical attention immediately. How often should you check for breathing during CPR? After each set of 30 compressions, what sign suggests someone has a head injury with possible pressure in the skull? Confusion, vomiting, unequal pupils. When treating a burn, why avoid using ice directly? It can damage the skin further. What's the correct first aid step if someone feels sudden severe chest pain and suspect heart attack? Give them aspirin, if no allergy, and call for help. And that wraps up your 30-question first aid and safety quiz. Subscribe and hit the bell so you never miss a quiz.